Hello, my case study was on the eradication of smallpox. For the background, smallpox affects only humans and has been dated back as early as 1157 BC. The disease was spread worldwide by traders, crusaders, and explorers and has killed 300 million people worldwide. The vaccine for smallpox was needed in experimentation began on the 10th century China-India through variolation, which proved to be pretty effective, yet there was a small chance, about 2%, that you would still die from getting a really aggressive form of the illness. And then the vaccine was officially made in 1796 by Dr. Jenner. A strategy to prevent spread was also a need to eradicate smallpox, and was created by Dr. Henderson in 1967 and used by the World Health Organization to battle the pandemic. A problem that the case does not address is the public responsibilities and duties during the pandemic worldwide, as well as the loss of popularity for the vaccination that could lead to an outbreak. A strength is that the vaccine was created pretty early on, is inexpensive, easy to administer, and does not require refrigeration. A weakness is that the vaccine does not give lifelong immunity. A threat is that by 1972, the vaccine was no longer routinely given due to the eradication, which opens up the door to another deadly outbreak and target to bioterrorism. As a result, an opportunity here is that we have the opportunity to market the vaccine to the public and immunize the population and protect from an outbreak. And the main objective of the World Health Organization was to eradicate smallpox, and their mission statement is to publish and spread internationally important health information to enable policymakers, researchers, and practitioners to be more effective. Some core issues here are that the reason that eradication for smallpox was difficult was the issue of lack of strategy to prevent the spread of containment of the illness. Another issue was the reintroduction by individuals who weren't vaccinated in smaller scales throughout the world. For example, in 1972, refugees returning to Bangladesh brought the disease back after its war for independence. The core issue currently in regards to smallpox is the lack of vaccination for it because it leaves the public vulnerable to another epidemic. So the case solutions is that the CDC, or Center for Disease and Control, keeps a stockpile of drugs and vaccines, enough for every person in the US in case of the reintroduction. The key health belief model messages to include perceived benefits of storage of these drugs, which is preventing a major scale outbreak. Alternative solutions are developing medication for smallpox since there is no cure at the moment, as well as educating health professionals and the public on the symptoms for early detection. My recommendation is to work with health professionals and departments in the government to develop an effective response. This would allow an appropriate and effective response that could reduce spread if an outbreak did occur. The action plan to my recommendation would be the government and health-related departments planning on how to respond to an outbreak. So probably setting a protocol and steps to how to respond to it, and then after that establishing those core steps needed to do during a pandemic, then practicing the responding so that when it does happen, people have experience and know how to handle this situation more effectively, rather than having just the steps made. In my summary and conclusion, smallpox, though eradicated thanks to vaccines and the World Health Organization, who strategically faced a pandemic, it still holds a threat to the world. Being prepared in all aspects of public health allows us to face an outbreak. This includes health professionals knowing symptoms, having enough vaccines readily available, and our country having a strategic plan to slow the spread and contain it. In my opinion, I believe that though having vaccines ready and trained health professionals to respond, introducing the vaccine once more would be a more definite way to prevent another fatal and massive outbreak. So what I'm trying to say here that since we have the resources to prevent this from happening. We do have the vaccine. In my opinion, it would be better if the vaccination was just given to our children and ourselves rather than waiting for another outbreak to occur. That way, there is no fatalities and it's less work. Thank you.